Chan. Dr. Chan is an infectious disease specialist on staff at Rhode Island Hospital and an associate professor of medicine at Brown. He's also the consulting medical director for the Rhode Island Department of Health. So, Dr. Chan, thank you for answering our questions today and welcome.
Thank you very much. Good to be here.
Yeah. We know President Biden has recently announced additional vaccines for every state. That means Rhode Island will be getting an additional 3,000 vaccines a week, taking us up to about 17,000. Still pretty insufficient for a population. But the question on everyone's mind is when, where, and how. So let's start, Dr. Chan, with when will adults 75 plus in Rhode Island get their vaccine and how will they be notified?
Yeah, so great questions. Happy to answer all those. And the one thing I'll add that's making me even more optimistic this morning is that the Johnson & Johnson just released some of their vaccine data that's very promising. So we anticipate that they will be submitting to the FDA for emergency use authorization in a very short time frame. So we anticipate by potentially March that we may have another vaccine here. And just to remind people that Johnson & Johnson vaccine is one dose. So I just want to preference everything we're about to say could change, frankly, by next week. And that's been one of the stories of the pandemic, is that we have to be a little bit flexible and nimble. I know there's a lot of frustration out there. There's a lot of eagerness to get this vaccine, which we love and we want to encourage. And we definitely acknowledge that. So this has been a little bit logistically challenging, and it's going to change again next week, potentially, and certainly in the near future as the Johnson & Johnson vaccine comes online. And we expect that to be approved too. So in general, great news. But the timeline I'm about to go over may change in the very near future. So just really briefly, our phase 1B with adults age 75 or older is set to begin next week. So that's very exciting. I think what was mentioned yesterday in our initial rollout of this is that we, the Department of Health, the state, in coordination with other state agencies, are going to look to registries, existing registries, and other sort of sources of registries where we can engage people age 75 and older. So we anticipate probably in about 2 weeks is that the general population, those that are 75 and older, as part of the general population, can start to register and get vaccine. And so I encourage people to pay attention to the Department of Health, our website, c19vaccineri.org. And just pay attention to the media, which I'm sure will blast this out the second it becomes available. So thank you again to the media for spreading the word. Mm-hmm. And then we're going to go in a stepwise approach for the other age groups. Sorry, Representative, did you want to follow up?
I just have a question again. So just to be clear, adults 75 plus then will be mid-February, somewhere around February 15th or 16th. The 75 plus that are being vaccinated that people are hearing about in the news are those special needs registry. And those are people who really have severe health conditions who are registered with their city or town. I know we have about 30 here in Jamestown. And that's very different than what you're talking about with the general population of 75 plus. I just want to make that distinction because I think that's where a lot of the confusion is. Is that correct?
Yes, absolutely. And just to remind people that the number one risk for people for dying or getting severely sick from COVID is age. And certainly people that are older, as well as those that have serious underlying conditions, that's when the mortality, the risk of death is really elevated. And that's why we, the state, as well as others around the country, have really adopted an aggressive age-based approach to delivering the vaccine. So this is based on the data and makes sense. And the stats are out there.
And so phase 2 seems to be more age-based and health-related. So when will adults 65 plus and those with underlying health conditions get their vaccine? And can you detail for us what those underlying health conditions are, please?
Yeah, for sure. So we anticipate towards the end of February, so towards the end of next month, is that adults in the age group of 65 to 74 will start to be vaccinated. So starting in March, that's when individuals, again, age 64 to 16 with underlying health conditions can also start to get vaccinated. And so we've realized through the pandemic, obviously, that people with underlying health conditions are going to be more likely to die, frankly, and have severe complications. And these include people with significant kidney disease, heart disease, diabetes, both type 1 and type 2, lung disease, and those who are immunocompromised, which includes people who have cancer, on chemotherapy, et cetera. So very high risk.
Yes. Heidi from Jamestown wants to know, will vaccination sites be set up in each local community, and what documentation do people need to bring to be vaccinated?
Great question. So at the moment, we do have some of what we call pods, points of distribution. They're essentially mass vaccination sites where people can go in, where we are referring people. We've been referring first responders, other outpatient healthcare providers, et cetera. There's a series of 5 of those plus throughout the state. We'll be opening more of these sort of state-sponsored clinics. And I think at the end of the day, too, we want to push some of this vaccine to clinics, community clinics. A lot of them are vaccinating. A lot of the community clinics in and around Providence, Central Falls, Pawtucket are able to vaccinate. At the end of the day, we do want to set up some of these local access points. The other area that we're looking at are local pharmacies. So obviously there's a lot of pharmacies in every community. We've already been using CVS and Walgreens for a long-term care facility. So we do anticipate that there should be one relatively close to you around the corner.
So the vaccine rollout, doctor, I mean, it's not just a health crisis, but it's also an operational issue, right? Mike and Susan from Middletown want to know if and when there will be a portal for people to sign up to register for a vaccine, not unlike what the Department of Health has done for the COVID test sites.
Yes, there should be. We're working on that as we speak. We want to be cautious about that too. I mean, we've noticed from other state experiences that, if this isn't done right, what happens is it's like you're trying to buy that concert ticket, right, to the most popular concert, Taylor Swift, whoever, and it's sold out in 30 seconds and you can't get in. And so we're doing this in a thoughtful manner, but we do want to ensure people that there will be a sign-up system, that people will be able to register, and we will get them. And I think to your point too about having to show up with verification, we are going to require some identification to prove who you are, of course, to show that you qualify.
Well, I think that's a good point about websites crashing, because we've heard so many different stories in states and even, here in Rhode Island. So we certainly want to avoid that. So DOH has told me that they're also going to be setting up a 1-800 number for people to call to schedule vaccines, because we have 1 in 4 seniors who do not use a computer. What's the timeline on that?
Yeah, that's something we're actively working on and exploring. So we'll have more information on that shortly. We are being very sensitive, I think, to your point, Representative, about, of course, there's a number of individuals 75 years of age and older who are who can't make it to, an access point, for a clinic to get vaccine potentially, and may not have access to technology as well. So we're being very thoughtful about that. And that's one reason why we're working with these registries, right, is where we are actively engaging people and not necessarily letting them come to us. So we're actively engaging some of those folks that are most at risk to get them vaccinated.
So what I hear you saying is you're going to be working more with municipalities and leaders, and you talked about the 5 regional pods. That's going to be more of the areas where people are going to be, filtered through to. So it's not just one DOH website that could crash with thousands of people trying to log on at the same time. Is that correct?
Yes, so I want to encourage people, of course, again, to pay attention to our website, but also to pay attention to your local city, town websites and leadership there, because we'll be working with them. Again, like so many things in the pandemic, it's really been a team effort, and we thank, obviously, the efforts of the towns and the cities, and they're key partners in this.
And I just want to share with people the website for any updated info on the vaccine is covid.ri.gov/vaccination. And my ops manager, Sydney, will put that in the chat box for you. So AARP has been talking about wanting a higher rate of vaccinations for people 50 plus. We also have had several emails from teachers who say they should be vaccinated first and seniors can stay at home, and teachers really are putting their lives on the line for students. How do you square those two demographics, and will certain occupations like teachers and even dentists, I've received a number of emails from dentists, will they be added to phase 2? And if not, why?
Yep, so all good questions. So I'll start with the dentist first, because that's easy. So dentists are actually prioritized as phase 1. So they're being vaccinated as we speak. So that was easy. I think on the teacher issue, I have a 9 and a 13-year-old here in the public school system in Rhode Island. And, as someone myself, that is on staff at Brown University and has regularly taught classes, I certainly understand and respect great respect for teachers and what they do. There was no easy way to do this. I think teachers obviously important parts of education, and we should be prioritizing education. I mean, education should be one of those things highly prioritized. However, I do think, and this was mentioned yesterday, if you look at what we're doing and the way that we're doing it, is that there's going to be 50% or more teachers that are going to be able to be vaccinated by the current age-based scheme. So I'm reassured that teachers will have, those at risk, teachers who are at risk are going to have access to vaccine. And the other part of the story, and there's been emerging news from this, lots of data reports and from the CDC and analyses from that first semester. And by the way, I've sent my kids to school in person since September. I'm gonna admit, I was a little bit nervous when I first did it, but I'm grateful that I did. And the more that we see, the more that we have learned that there's not a lot, there's really minimal ongoing transmission that happens in the K through 12 school system. So I've been reassured, but I also want to acknowledge that teachers need to be vaccinated. And certainly for those that are at risk, we're going to, prioritize them as part of this age-based strategy.
So we also have a number of emails, Dr. Chan, from people who have cancer and those who are autoimmune compromised. Will they be able to get a vaccine earlier if they don't fall into that 65 plus or 75 plus age category? And what do they need to do?
Yes, so good question. So absolutely, those who have cancer, those who are immunocompromised, people that have received transplants, and others, as I was mentioning, they will all be prioritized as part of early on in phase 2. So we're looking probably end of February, et cetera. But yes, they will all be prioritized. Obviously, being immunocompromised puts you at higher risk. So people of all ages with those other health conditions will be prioritized much earlier on to get the vaccine.
And just to be clear, when you reference phase 2, right, that is about when? What's your timeline?
So phase 2 is going to start next month. That was sort of the mid-February, end of February date that we're looking at, probably towards the end of February. However, I want to preference this again by saying that exciting news about more vaccine becoming available in general, Moderna and Pfizer, as well as the Johnson & Johnson vaccine. So that's why all these timelines are sort of tenuous. We're kind of giving you the current projections, but hopefully, hopefully it's sped up.
So I just want to be clear, because I think it is confusing and people just want to know, when is my vaccine going to happen? So people 75 plus, in about 2 weeks, February 15th, 16th, and in about 10 days, you're saying that Rhode Island Department of Health will have some kind of announcement on a portal system that will be regional with these pods. They'll have a 1-800 number. And then I'm looking at your timeline here, which I think is terrific, which is also in the website that I put in the chat. That shows adults 64 plus being more like mid-March. Is that correct?
So 64
to 16 with underlying health conditions.
Yes, so adults 65 to 74 would be towards the end of February, and then adults 60 to 64 would be mid-March, as well as other adults with underlying health conditions. So correct. So we're looking early to mid-March. But again, we hope that that's sped up with some of these recent developments.
Well, to your point, we've all lived through this coronavirus in almost a year now. And I think the most important thing is to wear comfortable shoes and be ready to pivot, because it changes constantly, right?
Love it. Absolutely.
The New York Times has had a number of articles. Pfizer has pushed the FDA to change the label so that they could get paid for that 6th dose that was in the vial, right? A number of frontline workers are saying that not all the doses are being used in the vial and that actually a special syringe is needed to extract that additional dose. Is that true? And are we using every dose that we can? And do we have the necessary syringes?
Yep, so good question. So just to even give people a little bit more of an overview, it's normal with vaccines and some of these medications that there's a little bit left over that we always discard. It's like, that's normal. It's So in the case of the Pfizer, and of course, given current circumstances, we want to make every effort to use every single drop of the vaccine. So the data that we've looked at and that we've released shows that in general, that's happening. Again, we've given tens of thousands of doses, and there have been a couple hundred, right, that have potentially been thrown out for various reasons, either that they've been left out too long, et cetera. But again, that's, I think it's 0.2% or less of the number of doses. So again, very small amount have been thrown out. We are really feel like that process is optimized as much as we can, given the logistics. And regarding the Pfizer, discussions with the federal government, I'll let them hash it out. Obviously, ideally, they should, consider that 6-dose extra and not be charging us for it, given that they didn't initially budget or charge us for it initially. So
good luck with that one. The federal government is planning to buy 200 million doses of vaccines that will be manufactured, and we're hearing delivered to the states by the summer sometime. When do you think everyone in Rhode Island who wants a vaccine will be immunized?
Yeah, I'm hopeful. Again, the other elephant in the room, the good elephant in the room, is that Johnson & Johnson vaccine. So if that comes to fruition, it will be much sooner. But based on where we are now, you're correct. By June, with the current way things are going, we anticipate that everyone would be able to be offered a vaccine, and that would be the younger age groups, talking about the 20s and the 30s year olds, et cetera. But again, I think it's going to be much faster, especially now that the Johnson & Johnson data looks so good, and that vaccine could be here within a month. So that will significantly speed up the timeline. So I'm optimistic it will be much sooner than that.
Is the Johnson & Johnson vaccine a one-shot protocol or 2 shots?
1 shot.
Mm-hmm. Good. Well, another question from Edna in Middletown. She's very concerned about this variant virus, and she's asking if she should be wearing 2 and 3 masks, and if so, what mask do you recommend for her to be safe?
Yeah, so I'm going to comment on what the data shows. I think we at the Department of Health would say you need to wear a mask. You should wear a mask.
Yeah.
The best mask would be an N95 mask. People are starting to be able to buy the manufacturing and supply lines are increasing. You can buy N95s or the Chinese version, the KN95s on Amazon. Those have been shown to be a little bit better than other masks. The second mask, which is good, would be a surgical sort of face mask. Looking around to see if I had one handy. I have one in the other room. I won't go grab it. But those blue masks, the surgical face masks, are really the second best. And we've learned that the cloth masks are the third best, and things like the gaiters and these other sort of pullovers are really not recommended, because what they actually do is when you breathe through them, they actually disperse things more. And so actually there's a little bit of evidence that suggests that even wearing those like pull-up things may actually be worse than wearing no mask at all. So in terms of double masking, Dr. Fauci mentioned, I think the key thing is if you wear a surgical mask, and if you want to wear a cloth mask over that, it may be a little bit better. We don't know for sure. It makes sense hypothetically that it would, and of course we would, if you wanted to do that, we would totally support that. And if you have access to a KN95 or an N95 mask, that's also good as well. But encouraging people to start thinking about using a surgical face mask, even over a cloth face mask. And in fact, there's some European countries that are starting to push that a little bit harder.
Ron from Jamestown asked if it's taking this long to get the first shot, how long is it going to take to get the second vaccine?
So curious if that means the second dose or another, sort of like the Johnson & Johnson vaccine.
Right. Well, let me ask you this question too. If somebody gets the Pfizer dose, then they do have to get the second shot, correct?
Correct. So both the Pfizer and the Moderna are 2 shots. So you want to get those, 21 to 28 days apart, depending on which brand you get. The Johnson & Johnson is 1 dose. And again, the reason why these dosing, number of doses, is because that's what the studies, based on science, they decided that you probably needed 2 shots. And then that's what they studied, that you needed 2 shots. And that's where that 95%, effectiveness number comes from for the Pfizer and Moderna. So to be 95% effective, you need those 2 shots, and it was studied within this time frame, which is why that's recommended.
What's the efficacy rate of the Johnson & Johnson 1 shot? Is that 95% also?
It is going to be lower. The data was released. I don't want to quote the wrong number for you. It is lower than that, but it's still good, and it's still what we consider good, and it's still certainly above any threshold that we would still want to give it, and people should get it when it comes out.
So if someone gets the vaccine, say in March, April, do they still need to wear a mask until everyone is vaccinated?
Great question. So here's one of the biggest questions regarding vaccines. So when we talk about the Pfizer and the Moderna being 95% effective, it's 95% effective against causing disease from COVID-19. So COVID won't make you sick. You're not going to end up in the hospital, and likely not to die, of course. So the one thing that we don't know is whether you can still be infected with the virus and have asymptomatic infection. So it may be that the vaccines may not quite prevent you from having asymptomatic infection to that 95% level. We hope so. My guess is it may be a little bit lower. We don't know how much. So we are asking people, even when vaccinated, to be careful, which includes, of course, wearing a mask, physically distancing, social distancing, et cetera. So at this time, now that being said, in the next month or two, there's going to be lots more data coming to show exactly that, and whether or not people who are vaccinated are really totally protected from getting infected.
Yeah, there's still a lot of data that's coming out every day. Chris from Middletown is asking if we have short supply of vaccines, and I'm not sure we will by the summertime. Should we be looking at the Regeneron antibody as a treatment? I thought the Regeneron was only a treatment if you had COVID and pretty severe. Can you explain that difference?
Yeah, it's a great question. So when you get into the hospital, we'll start there. There's been a couple of treatments that we've used. So there's this the drug known as remdesivir. We know that dexamethasone, which is a very common steroid. A lot of these treatments are effective in people that are sick enough to be in the hospital at preventing people from progressing. There's only one treatment for mild to moderate COVID-19. So before you get into the hospital, and that's where these monoclonal antibodies fit in. So it is the only treatment that has shown some effectiveness in preventing people from really getting sick enough to even get into the hospital. So that's sort of the use of those. And again, it is recommended for people who are 65 and older, people that have other underlying health conditions that put them at risk of significant COVID-19 disease. So those are the people that we should consider the monoclonal antibody treatment for.
Is there a plan by the Department of Health, first responders, and municipal partners, and I think you alluded to this earlier, to establish vaccination stations at designated sites in each local community? Or do you think it's going to be these 5 regional pods that you've already set up?
Yeah, it's going to be more than the regional pods. We are still working on finalizing some of those logistics, so I don't want to misspeak. Some of it is going to rely on what the town or city themselves want. Again, things that we're looking at are local pharmacies. Certainly, we're looking at local, community centers broadly speaking as points where, places where people can have easy access to. So everything's on the table at this point, and I know that there's a lot coming down the pipeline and more information soon.
And then Colleen from Middletown, who's a hairstylist, wants to know when she and others like her who work with people every day will get the vaccine.
Yep, good question. So again, we understand there's a lot of professions that engage in sort of high contact, person-to-person engagement. And, that does put you at higher risk, of course, from COVID-19. Again, I've been reassured that because people have been so diligently following a lot of what we've recommended, we're not seeing a whole lot of outbreaks in a lot of the business sectors, which is fantastic. So our recommendations at this time are to continue doing what you're doing, which seems to be working. I think I need my haircut in the very near future.
I think
so
it looks
I may be
great.
visiting one of you. Thank you. And we are prioritizing, obviously, again, in these professions, we are prioritizing people based on age and underlying medical conditions. If you are at risk based on age or underlying health conditions, then obviously you will qualify for a vaccine.
So in the final minutes that we have, Dr. Chan, let's do what I like to call a lightning round, okay? Real short answers, but a recap of what you've said, because you've said a lot in the last 30 minutes. When will people 65 plus expect to get their vaccine?
65 plus, end of February.
Okay, and what about those who are 75 plus?
75 plus starting now, basically this weekend, next week, based on these registries. General population 75 plus in a couple weeks.
Okay. And again, the special registries are people who have certain health conditions. They've already registered with their city or town, and the town officials are calling them over the next several days to give them the vaccine, correct? That's very different
Correct.
than the registry that we're going to set up probably in about 2 weeks, correct?
Correct.
And how will people be notified?
So people will be notified of those other age groups, the general population, through extensive media communications, including our website, again, c19vaccineri.org, and also through local cities and towns. So make sure to stay in touch with them, their websites, etc.
Okay, great. And then when do you think the state will set up those portals that you talked about earlier so people can go online and register for an appointment in their local community for a vaccine? And also the 1-800 number that's really important for so many seniors who don't have access to a computer.
Yep, good question. We're working on that as soon as possible. More information to come, hopefully by next week.
Okay, that's pretty succinct. When do you think every Rhode Islander who wants a vaccine is going to be vaccinated?
I'm going to give two answers. Based on current projections, by June or July at the latest. I'm optimistic that it's going to be at least a month sooner than that, based on current data from the Johnson & Johnson vaccine, and maybe even sooner than that.
Wow, that's pretty encouraging. And I hope your information has kind of assuaged a lot of the concern and the anxiety that a lot of people have, that we all will get a vaccination. We just have to be patient and realize it will take a little bit of time, right?
Yes, just encouraging, again, people to be patient. I know some of this has been frustrating. There's a lot of hoops to jump through, a lot of challenges getting it. And just remembering too that we're in a much better place over the last month here, right? Our rates now, our positivity rates are less than 5%. Our cases are coming down. And also recognizing that every shot that any Rhode Islander gets, whether it be yourself or someone else, is one step in the right direction and one step to reducing community transmission. So I know it's frustrating that you yourself may not be able to get it. We're working on it. We're obviously prioritizing people that are most at risk of dying, which is where we're going.
Great. Thank you so much. You've been a delight, Dr. Chan. I appreciate you taking time out of your busy day. I know you're seeing patients in between this. And I want to thank so many people for submitting questions. If you need more vaccine information, covid.ri.gov/vaccination. Thank you so much for joining us. This will also be up on my Facebook page, as well as my website, which is debruggiero.com. Thank you, Dr. Chan, and thank you everyone for joining us. Mask up and stay well. Ciao.
Thank you all.